Hello, everyone. This is Your Practice, Your Money, where clinical success meets financial freedom. And I'm your host, Dr. Dimitrios Kostopoulos. And welcome to today's episode. Very special episode today, since I have as my guests two clinicians, two physical therapists who have recently achieved some of the ultimate achievement in the physical therapy profession. We're going to hear all about it. We'll hear about them. We'll hear how they are using this new skill and knowledge that they have acquired right now in just a moment. So stay with me. Welcome back to Your Practice, Your Money, where clinical success meets financial freedom. And today we have two amazing physical therapists who recently some major achievement accomplished, Dr. Kevin and Dr. Anthony.
Thank you. I've been practicing for about 10 years now. I have some credentials. I completed my MBT credentialing. I have dry needling background, some LSVT big stuff I've been working on. And of course, the diagnostics, MSK ultrasound, and just recently the ECS. 10 years goes by really fast.
All right. So Dr. Kevin, Kevin, tell us something about you.
My name's Kevin, and I've only been practicing 5 years, so not as long as Dini and Anthony have been in practice. Kind of like Anthony, I've also done a little bit of LSVT, and realistically, I've only had the chance of the ECS recently. So those are kind of the two things I do, and work out of an orthopedic office in Northwest Pennsylvania.
Awesome. Very good. And first of all, I want to just make the announcement that you guys just recently accomplished the very prestigious and very cumbersome to get title of ECS. ECS stands for Electrodiagnostic Clinical Specialist. These are physical therapy providers who they obtain knowledge and expertise in the area of electrodiagnosis. Many of them, they obtain their training through residency programs. For example, Hands-on Diagnostics has an accredited residency by APTA, by ABPTRFE in clinical electrophysiology testing. And these are the programs that Anthony and Kevin completed. And then they moved on to take their exam in clinical electrodiagnosis, and they achieved their ECS just recently. So congratulations to both of you. It's a very big deal. And actually, I would say is a very big deal because it has quite a few requirements to get there, but also it is a recognition that also allows the therapist to be able to build a totally new and separate amount of CPT codes that other type of certifications do not allow. For example, we have in the country more than 25, I think, thousand at this point, orthopedic clinical specialists. And that's fantastic. That's really great. At the same time, an orthopedic clinical specialist will bill exactly the same codes that a non-orthopedic clinical specialist will bill, will apply similar procedures. But an ECS, like you guys just achieved, can perform different type of procedures and can bill for these procedures. So, Anthony, how come you got involved in this?
I was approached by my boss, Harry Koster, and he had suggested and recommended, this new, I had never heard of, this kind of testing before. And he had brought it up to me. He had a little private meeting with me. We were talking about it. And I was like, okay, sure. I'm down to learn anything and as much as possible. Little did I know what I was getting myself into. But really, there was nothing, kind of grand about my finding of diagnostic testing. It was more of like, okay, my boss introduced it to me. I started looking into it, did a couple of the webinars online, and, I started to realize that there is something bigger with this. There's something that, I never thought in my career that I honestly felt I was behind. I had probably been practicing about 4 or 5 years. And when I started getting in and listening to the podcasts and the Wednesday webinars and stuff, I started to become very interested about, well, where's this knowledge going to take me? So in a nutshell, it was introduced to me. I started researching it. I fell in love with it. I knew there was a lot of potential behind it. That's my beginnings with diagnostics.
Awesome. The vast majority of people who will get involved in this, they may get involved for many different reasons. Either they are curious about it, they are at a stage in their professional careers where they're looking for something different, something new. But once they get exposed and they start learning, that they're like, oh my God, this is a totally different ball game of experience, expertise, of process, and of ability to evaluate, diagnose, and treat people. So, Kevin, how about you?
Kind of like Anthony, Eddie St. Clair, the owner of our clinic, came and talked to me about joining HODS. We already had one ECS beforehand in Jess Collins, and we kind of talked about the pros and cons of joining up and doing nerve testing and what it would entail. I was really intrigued by the knowledge that Jess had gotten, just seeing her change from this program and how she looked at things. That was something I wanted too. I was 2 years out of college, I believe, when I started this program. And just the idea of having that additional knowledge for outpatient clinical work, as well as having that ability to see nerve problems more clearly, that was an attractive thought process for me. Kind of like Anthony, I didn't expect it to be as grueling, but I'm glad I went through it. And I feel like I'm a better clinician from it. But basically, just wanting to improve in practice was my primary driving factor.
Awesome. That's absolutely fantastic. This past year, actually, when it comes to electrodiagnosis, we have probably around the country less than 250. And many of these people are in academia, right? They are not even practicing. So you guys are like really the cream of the crop out there, a very small minority of physical therapy professionals who have achieved this. And I'm very proud to say that out of the 21 ECSs this past year, 18 of them came from our program. So that is really a testament of the program and the type of professionals that we have and our students. So, what is the difference of viewpoint on how you view your patients and how you view your community and the profession before EMG type of involvement of Anthony to the after EMG involvement of Anthony? So before ECS Anthony and after ECS Anthony in relation to your patients and how you approach them.
Really, after ECS, it opened up a new paradigm for me of how I view my patients. Before ECS, as a patient, I had a diagnosis. I'm going to run with this. That's how I was taught. That's how we normally thought the process went. Post ECS, I'm thinking about a lot of different things now. I'm putting together, connecting the dots. This could be this could be this could be this, adding more complex thought into my evals. It's not just a basic evaluation now. Now I'm doing an evaluation. I can understand and I can see this looks like it could be this. With the diagnostics incorporated, I can find out for myself. If we're dealing with a radiculopathy, cervical radiculopathy, for example, I can go and tease that out with diagnostics. And I'm not spinning my wheels in the mud working on a patient that's not getting better. The pre-ECS Anthony, that's what I was doing. I was like, Yeah, someone might feel better if you work on someone's neck for 24 visits, but you still haven't solved the problem. Post ECS, I understand where the problem is and I can go to it directly. It's opened up a whole new paradigm shift for me. I can understand patients a lot. I can understand their stories. I can understand symptoms, symptomology, presentation. So it's just really unlocked a whole new door of capability for me. And then when you combine, the findings on an EMG, you know exactly how to treat them. When you implement the sliding, gliding techniques, the nerve glides, and you can help them versus hurt them. I was having a conversation, with my peers about, when we do nerve tension tests. In school, we just kind of add in a neurotension test, but it wasn't very, specific to anything that we were doing. And we just were taught that that's a treatment technique to use. But there was really no ifs, ands, or buts other than just do it. Now it's like, okay, I can do the wrong technique and further injure this patient if I don't know what I'm dealing with. So with diagnostics, now I can incorporate the proper nerve gliding techniques to ensure that the patient doesn't get worse, in fact, gets better, progresses. So yes, in a nutshell, I could go on and on about this. It's really helped me hone in my skills as far as critical thinking, adding in my interventions.
I want to hear about Kevin now, like the before and after ECS Kevin. How does that compare?
When I started the physical therapy career, kind of like Anthony, we were just kind of going through the special test, range of motion, and kind of just kind of seeing what we had and kind of working with it. But through the HODS program, I really felt that my clinical decision making, my critical thinking improved. And kind of like what you said, Demi, you meet some people along the way in the HODS program that really also help to reorganize your brain in terms of critical thinking and thinking about differential diagnoses. And with the ECS now, right now we have that ability, like Anthony said, to pinpoint problems, whereas previously you would or might just choose to do the wrong thing and use a tensioner when you shouldn't. I remember I went down to Florida with Jen, and she was really good at kind of explaining the different neurodynamics to me while we were in her clinic, and I was helping her out with some EMGs down in Florida. Just my ability to tease out problems and confirm them with diagnostics is probably the biggest difference, as well as choosing the proper techniques to treat patients after you have the findings. It's very rewarding to see your clinical thinking kind of go through that process and it work on patients. That would be the biggest difference, is that precision and that ability to tease out, versus before it might just be a little more of a carpet bomb, I guess. You're just trying to do what you can to get them feeling better, whereas now you're more precise. It's more of like a sniper rifle in one way or another.
I totally understand that because this is something that I have experienced personally in the many years of treating patients and studying and evolving also as a clinician. It was day and night, really. And the knowledge and expertise that you have right now, it is far and beyond that a general physician has. And it is up to par in the area of electrodiagnostics with the knowledge that a neurologist has and the knowledge that a physiatrist has. I wrote a white paper actually looking at a variety of studies comparing teaching programs of physicians, neurologists, physiatrists across the country and those of physical therapists. And the programs that we have as physical therapists to train in electrodiagnosis, you dedicate a lot more time and a lot more mentored reports than physician programs. And if you go to yourpracticeyourmoney.com, I'm going to make sure that I will post that white paper so you guys can go and see what the research says and the resources out there say about that. But I want to ask you for a specific case that you have had that you can describe on how the information you got from the diagnostic testing you did in this case EMG or even maybe ultrasound, how that changed the way you actually manage that patient, if you can describe that a bit.
Actually, just recently, we had a referral for a patient for cervicalgia. And, cervicalgia is not very descriptive. It's basically see what's wrong, treat the neck. And this was one of my clinicians doing this eval. It wasn't me. I did the EMG though. One of my clinicians suspected something else was going on. And this is us bringing in diagnostics already to our therapists. They knew what to do. He was thinking that something else was going on. Numbness, tingling in the hands, numbness, tingling throughout the forearms, arms. Sounded like more of a distal to proximal progression of symptoms. So, okay, special testing, cervical spine, inconclusive. So they recommended electromyography. And doing the exam, of course, I go through my own special testing, my own subjective, and then proceeded to do the exam. Lo and behold, this patient had a moderate to severe median neuropathy at the wrists, bilaterally, potentially the cause of the numbness tingling throughout the arms. And what most people don't realize is when you start taking these courses with HODS, they teach you that carpal tunnel syndrome isn't textbook presentation as what we read. It often involves the whole hand. Symptoms can radiate proximally, even to the shoulder. Definitely the diagnosis, can it change? Well, we wanted to. We quickly drawed up a reevaluation plan of care, and we're going to have the doctor look at it and potentially add in median neuropathy as part of the diagnosis. But we'll continue to treat the neck. Of course, this patient did have neck pain, but also we can now help the patient with all of their symptoms now that we know what's going on precisely. As Kevin alluded to, earlier, almost like a sniper rifle. We precision as far as our diagnosis that now this patient's going to get the help they need.
That's a great example, by the way. And let's take this example that you mentioned, right? Even if it is subsymptomatic in terms of the carpal tunnel, but you have more of the neck symptoms and radiating pain or this or that. If the carpal tunnel is not being treated at this point in time, and 6 weeks of treatment go by with the neck treatment and the patient feels better with the neck, what will end up happening with the carpal tunnel in 2 months, in 3 months from now?
Correct.
It will worsen. Two of the things that they are not mentioned that much in the literature is that, one, early detection through electrodiagnosis can avoid complications in various cases, but also early detection can avoid worsening of a condition that will require at some point in time more invasive intervention. Because right now, when you get to identify a simple mild demyelination, you will do your mobilization techniques, you'll do some stretching exercises, you'll do PT, and it will resolve the issue. But if the demyelination continues, becoming worse, develops in axonal pathology, and then you start losing axons, and the person starts dropping objects now, then situation is far gone, and you need to resort to injections and surgeries and so on and so forth. That's very important. Thank you, Anthony. So, Kevin, how about you? A case?
Yeah, so most definitely. We've been using some EMGs in nerve conduction studies for treatment, but we have had a patient that was coming in from the doctor just for an EMG to see if there was anything there. It was for low back pain and radiating down the right leg. We did the EMG, we did the nerve conduction studies, and more or less it was a completely normal study. So that allowed us to say, we can help you at PT right now in terms of nerve glides, slides and glides, because it was a normal study, as well as just some manual therapy along the pathway of the nerve. That patient did see resolution of their symptoms relatively quick They responded well. I feel that test might have saved the patient some additional interventions, things like that.
A test like this, an EMG test, will not only help to localize the problem, not only it will help with the severity of the problem, but you are going to be able to determine some prognosis about the patient's case and discuss with them what to anticipate. Because if the patient's reality is, I'm expecting to be totally good with physical therapy within 2 to 3 weeks, meanwhile, you have a severe axonal pathology as per EMG, well, that will take a lot longer than just 2 weeks of physical therapy. It can help also in prognosis. Those of you who are watching or listening to this and you want to find out more about this, you can definitely contact our team. You can go to our websites and you can get all the data you need. And I have opened up 2 meetings per week in my schedule. I have 2 openings right now in the next 3 weeks. You can go to www.meetwithdimi.com. You can book a meeting with me and I'll be very happy to walk you through these programs and discuss with you what difference one of these programs can make for your specific situation. So, what is your next step? What is the future of Anthony post ECS as a clinician, as a therapist, as a professional? What's your next step?
Well, the spinal rehab I've been discussing is implementing a polyneuropathy restorative program. So that's one direction, using the newbie device to help nerve and regeneration. So we're gonna, move that direction. We're gonna try to, advertise this, open this up. And beyond that, I do enjoy teaching. I do enjoy sending my knowledge out to my peers, to new grads. I'm actually going to be doing a talk in a couple of weeks about ECS. I'm kind of setting off onto this educational, I want to spread the word about diagnostics, EMG, MSK ultrasound, doing things in the clinic, and then going out to the community, doing things like that.
Fantastic. We love to have new mentors at HODS. Anytime, just contact me and we can figure something out. That would be really awesome. Tell us a little bit more, Anthony, about Harris practice. What do you guys do and how people can get in touch with you?
So I work with Harry Kostier. He's the owner of a private practice outpatient clinic called Spine and Rehab Specialists. Our goal is to fully integrate diagnostics into our practice. Personally, I'm doing about 12 to 15 EMGs per week. We do have another ECS trained therapist who's doing more than that per week. We try to expedite waiting periods for EMGs, can be 6 months or more, and we all know what can happen within 6 months time frame. We fully integrate our diagnostics into our practice. We see everything, anything orthopedic, concussion, even vestibular. We can go a little bit beyond that as well. We're very active in our community also. Any consultation, if you feel like you need electrodiagnostics, to get a hold of us, we try to make it extremely easy. It's merely sending us an email or picking up the phone, giving us a call, or just simply walking into the clinic. We accept a ton of insurances. We try to make it very easy. Our front desk is very good at processing all this paperwork. We have cash pay services as well, care credit and stuff like that. We're expanding this not only internally, with our own evals, but also externally to the community. Our private practice at Spine Rehab Specialists, we are located in El Paso, Texas.
And what is your website?
Spineandrehab.net.
Kevin, how about you? What is in your near future?
Well, I'm hoping to continue to work as a therapist and grow it in the outpatient therapy world. I'm so early in my career, 5 years in. So I feel like I got a lot more left to learn and get better at and improve in. This EMG, nerve conduction studies, I want to continue to read and get better at them, become more efficient with them, testing wise, and kind of like Anthony said, you use them more in clinical practice. I want to continue to give back to the community, give back to, young professionals trying to get into PT too. I love physical therapy as a practice. And I think that we have a very bright future, and I don't want to see this profession go away. And that's something I think hands-on diagnostics does really well to keep the PT profession as interesting as possible. Diagnostics wasn't something I ever thought about coming through school, but I'm glad I joined and learned about it because it's really made me the PT I am today. Kind of like Anthony said, I'd like to talk to some students, go to schools. I'm actually headed back to Slippery Rock University and probably doing a small talk where I love talking to the students about diagnostics. I just want to continue to get better as a PT and start giving back to the profession. That's what I want to do.
That's awesome. And tell us a little bit about your practice and Eddie's practice and everything.
Yeah, so I work for Eddie St. Clair. He's the owner of West Park Rehab in Franklin, Pennsylvania. We have a second location in Seneca, Pennsylvania. We offer multiple specialties. We have hand therapy, we have pelvic health, we have Parkinson's LSVT-based treatments, as well as musculoskeletal ultrasound. We can be reached via phone call and our website, westparkrehab.com. We'd love to get to know any new patients coming in. We have a phenomenal front desk staff that does a great job at getting people in a timely manner. And we do diagnostic testing in West Park Rehab as well, where I would do your nerve conduction test.
Thank you, guys. Once again, congratulations to both of you. Thank you for doing this and really helping the profession to advance. That's really fantastic. And one more time, congratulations. Also, the practices that both of you are working, both Eddie St. Clair's practice and Harry Costa's practice and your teams, in the past couple of years, they have achieved the Practice of the Year award of hands-on diagnostics. Let's watch it.
My name is Harry Koster. I'm a physical therapist and I'm the owner of Spine and Rehab Specialists. So back in 1997, there was a Dutch physical therapist who had a little private practice here. He was going to be leaving town, so he asked me to see if I wanted to just take over his space, maybe buy some of his equipment, and start my own little physical therapy company. Originally, I said no. I think that was my wake-up call saying, this is what you want to do. Life is short. Just go ahead and take the risk, take the plunge, and do it. So I started, Spine and Rehab Specialist back in 1997. I'm married to Bonnie, who also works in the practice. She's the admin director. I'm actually the perfect example of how sometimes you can get a quick and accurate diagnosis. I was starting to have some knee pain a couple of months ago. Didn't really know what it was. I know it was not in the joint. I have my own physical therapy skills, but I just didn't know what it was. But it was really hindering me from squatting, going up and down stairs, really bothering me. And I wanted to make sure I treated it the right way. So we looked at it with the MSK ultrasound, and guess what? I had a little calcification in the tendon. I actually dry needled my own quad tendon, and the symptoms went away. So within a day, I had the accurate diagnosis. I had the appropriate treatment. It was one treatment. The problem is gone. So how beautiful is that?
Hello, my name is Adrian DeLuna. I am the Assistant Clinic Director here at Spine and Rehab Specialist. I've been working with Harry and Bonnie for going on 11 years now, and it's been great so far. HODS has given us the tools to be successful with marketing, going into different doctors' offices and build relationships with the front desk, and then bringing Harry in after a couple of visits, and then bringing Anthony, bringing Raji, and it's just been really successful for us, and we continue to have great success with it.
Hey guys, my name's Anthony. I've been practicing as a PT for going on 10 years now. I am the clinical manager here at our physician's location at Spine and Rehab Specialists.
This clinic's always pushing the boundaries. That's how I feel. We're always learning new things, trying new things, being innovative. One thing that kind of stood out to me the most when I was learning about diagnostics is the certainty that it came with, and being able to establish accurate PT diagnosis and delivering accurate care.
My name is Rajeshwari Soni, and I'm working as a physical therapist and a diagnostician here at a spine and rehab specialist in El Paso, Texas. And I have my board certification in clinical electrophysiology, and I'm registered in musculoskeletal sonograms. So I do both physical therapy patients and diagnostic testings.
So our journey with HODS was a little struggle at the beginning. We got a little bit going, and then the pandemic hit. Couldn't travel to New York. I think we were all hesitant to travel, so started doing some MSK ultrasounds, I think early 2021 maybe, and then started doing EMGs later on in 2022. Well, HODS truly is a partner in getting us up and going, giving us the training for the clinical techniques. EMGs is not an easy it's not an easy process. You really have to understand the techniques of what you're doing, as well as which nerves are you testing, and really have to understand the whole anatomy, the neuroanatomy, way better. So they definitely help with that training process, but also just the whole, business of diagnostics. It's not natural for physical therapists to bill for diagnostics. Some insurance companies are, not necessarily willing to pay us because we're not medical doctors. So to have HODS as a backup to allow us to thrive in this space, it's been invaluable.
We are happy to present to you the 2025 Practice of the Year Award winners.
Congratulations to Harry and Bonnie Koster and the entire team at Spine and Rehab Specialists.
I found it difficult to find a big downside for using diagnostics in my practice. We had already established ourselves from a rehab provider, and diagnostics seemed to be the absolute most logical next step to take this practice to that next level. Hi, I'm Eddie St. Clair, physical therapist and founder of West Park Rehab, Physical Therapy, and now West Park Diagnostics, and I am a proud HODS owner. Using diagnostic information helps our therapists give their patients a deeper perspective and clarification of the problem that they have. So the way that we provide our rehab services, it's a little different. In our business, we have a dedicated therapist who only does EMGs and nerve conduction, a separate therapist who only does the diagnostic ultrasound, and I then take on the managerial role of negotiating contracts, working on relationships with referral sources, assisting our marketing team to then encourage individuals to use our diagnostic services. So one of the things that has happened recently is that our diagnostic business has expanded from in-house services to now providing EMG testing for a very large and well-respected medical organization. I know what I know when it comes to treating the upper extremity. I am profoundly confident in what I do. Negotiating something of this magnitude is not something I was comfortable with. Dimi and HODS was able to provide me really some fantastic documentation, some things that were already pre-packaged. We were ultimately successful in finding our way as now a provider, not only within the four walls of West Park Rehab and Diagnostics, but now on a larger scene in a local hospital system. Very exciting. This is a really intelligent, passionate group of people. It is a community, and I am edified as a private practice owner to be part of it. You can't do this long-term alone. You need support, you need to bounce ideas, and you need to be with people who are winning. And that's what I think I get with my participation in HODS. I'm with a winning team.
Congratulations to 2022 Practice of the Year Award recipient Eddie St. Clair and his team at West Park Rehab and Diagnostics.
Wow. So this was pretty amazing. And I loved watching those videos with the awardees, very well deserved for both practices. And once again, Anthony and Kevin, congratulations once again. Thank you so much for joining me today.
Thank you, Dimi. Thanks for having
Thanks, Bimi.
All right. So this was one more episode from Your Practice, Your Money, where clinical success meets financial freedom. Please subscribe right below and also forward this episode to any of your friends or colleagues, and also rate us, because your ratings allow us to be more visible in the various platforms where you are listening or watching. Until next week, take care and keep working with amazing success and financial freedom. Take care, everyone.